Medicare Rights Center. May I help you?
Sure. I can send you a list of places in your state that discount medication.
There may be some programs that can help pay for your drugs. What state do you live in?
Staff members and expert volunteers at the Medicare Rights Center field thousands of calls to the hotline from frustrated, frightened, or confused people. Each caller hoping to get their Medicare questions answered in a simple, clear, and compassionate way.
Every day, our phones ring off the hook with calls from older and disabled Americans who can't get access to the care that they need. Because Medicare health insurance plans like Medicare Advantage plans and Part D prescription drug plans don't often pay for the care that they're supposed to cover, people go without critical care. The Medicare Rights Center, for over 20 years, has helped over 1 million people get access to care.
Good morning, Medicare Rights Center.
Our hotline is their lifeline. It's their calls that motivate us, that drive us, and inspire us to do the work we do.
Let me get this straight. Your doctor said you need a wheelchair, but the equipment supplier said Medicare won't pay for it?
Sure, I can explain what donut hole means.
So we actually get a lot of referrals from government organizations, social service organizations, even other insurance companies will refer their clients to us because we treat every client with respect and we really make sure that clients understand the ins and outs of the Medicare system and exactly how their benefits work. Sometimes their issues can be solved with a simple phone call. If it takes more than a phone call to solve their problems, then we do have caseworkers on staff who can get involved and make sure that their issues are resolved. You know, because Medicare is a very complex system, and that's why we do the best we can to try and help people try to explain it in, very consumer-friendly terms.
Most people don't have a clue that having Medicare only gets them partial coverage until they or a family member gets sick. On top of coinsurance and deductibles, they must pay in full for prescription drugs once they hit the donut hole. They often don't know what to do if they can't get the care they need.
I came to the Medicare Rights Center when I turned 65 and I started collecting Medicare because I couldn't afford to pay for my doctor's bills and my prescriptions. And the caseworker helped me figure out how to handle these expenses, and he also told me about a Medicare savings program, which I had never heard of, and he was a godsend. I'm so grateful to him because it saved me so much money.
Medicare Rights Center first came to my attention more than 15 years ago, and I've watched it grow to meet the education and the direct service needs of consumers, especially those with low incomes. Medicare Rights Center's work to break down the barriers for persons who are dually eligible, those eligible for both Medicare and Medicaid, that they have in accessing services has truly been groundbreaking. MRC is an example of how we can work effectively at the federal, the state, and the local level to make real policy changes.
Medicare Rights has grown from a staff of 1 to a staff of 40 and built from scratch a volunteer corps of around 200 Medicare experts in New York City and Westchester County. During the past 20 years, staff and volunteers became experts and put that knowledge online. Medicare Interactive, a comprehensive consumer-friendly resource, receives more than 400,000 visits per year and continues to grow.
We do all the processing for you. You don't have to go anywhere or do anything at all. Everything will be done for you through the Medicare Rights Center.
Of course, the heart of Medicare Rights continues to be the hotline, just as it was 20 years ago when Medicare Rights was founded. What started then as a trickle of calls from confused older adults and people with disabilities has grown into a torrent of calls from consumers and professionals who know that Medicare Rights can help navigate the complexities of American health insurance today. Last year, the hotline services, combined with live and virtual community presentations, helped 85,000 consumers, caregivers, and professionals understand Medicare.
I recently got a call from a paraplegic, a young man in his 30s, who said that he was getting accustomed to managing in his wheelchair. But he had fallen out of the wheelchair and broken his 2 front teeth, and now he would no longer go out of the house at all because he was embarrassed about that. A dentist told him it would cost about $1,800 to start repairing his teeth, but he didn't have any money at all. And I was able to help him happily apply for a private fund that was able to give him a one-time $1,800. He was able to go to the dentist and get his smile back, and it was so satisfying and rewarding to be able to do that.
As a granddaughter of a woman on Medicare, I can personally appreciate the wonderful work accomplished by the Medicare Rights Center. It's comforting to know there's an organization like MRC out there advocating for the rights of seniors and the disabled. And that's why I'm really proud to be part of this organization.
You know, after over 13 years of doing this, it still feels pretty good to know at the end of the day I've done something worthwhile to help somebody.
The Medicare Rights Center's frontline experience for the last 2 decades has helped to propel us to the forefront of the Medicare debate. Elected officials, policymakers, and the media all frequently call upon us to be the voice of people with Medicare. By 2030, almost 1 in every 5 Americans, 71.5 million people, will be 65 and older and eligible for Medicare, and we have to be there to help them. Solving Medicare problems directly, providing policymakers with essential first-hand information, leading the debate and changing policy. That's the Medicare Rights Center.
Glad I could help you.
Please call us back if you have any more questions.
Have a good day.